Now, coming to the section of the portal circulation. So the portal venous system, it drains all the blood through capillaries from the different digestive organs such as the esophagus, the stomach, small intestine, large intestine, the spleen, pancreas. So these are all the organs from where the blood it drains into the portal vein and into the liver. So this is a diagram of the liver and the system. So first of all, we've got the inferior vena cava, which drains most of the blood from the lower part of the body. And then we've got our left hepatic vein, and then the middle hepatic vein, and the right hepatic vein. We've got the hepatic sinusites that are present within the liver. We've got our portal vein, through which I've mentioned that all the blood from the different organs drains into the portal vein. Then we've got the splenic vein, which drains the blood straight from the spleen. This is the spleen. And then we've got the superior mesenteric artery, inferior mesenteric vein, and the left colon. So what really happens is that the portal vein is comprised of the splenic vein, the inferior mesenteric vein, but it usually drains into the splenic vein and then the superior mesenteric vein. So the portal vein is approximately 7.5 centimeters in length, and it goes parallel with the hepatic artery and the bile duct, and it usually drains into the hepatic into the liver and dividing into the right portal vein and the left portal vein. So the liver receives the blood supply from all of these organs, and it constitutes to almost 30% of the cardiac output. So what really happens is that the portal vein drains into the liver, and then from there the hepatic veins, hepatic artery is also supplying the liver. So it constitutes around 30%. So, for example, if there is a chance that there is some hepatic artery thrombosis, for example, in some of the portal system, that the artery thrombosis. So what really happens is that there's a compensatory method, and what happens that most of the blood is drained through the portal vein into the inferior vena cava. But then if there is a chance that the portal vein is thrombosed, so then the hepatic artery does the compensation, and it causes the buffering system. So this is also called as the hepatic altered buffer response, which causes a compensation between the artery and the vein. So now if we talk about the hepatic microvasculature, if we talk in a very detailed electron microscopic level, so what really happens is that if we talk about the sinusites, first of all, we've got the sinusoidal lumen, and it has a lot of fenestrations in between. So the sinusoidal endothelial cells have a lot of spaces in between, which is called as the sinusites. And then we've got a space of this, which is a unique space which consists of all these cells, and it's an empty space in between. And then we've got the hepatic stellate cells, and then the hepatocytes. So the hepatic stellate cells are placed within the extraluminal of the endothelial cells. So these usually play an important role in regulating the hemodynamics and the homeostasis of the liver. Also, it causes it allows the transport of different macromolecules and molecules. So this is a picture at the molecular level. So this is the picture of a normal sinusoidal microvasculature. And then if we talk about cirrhosis, so what really happens is that, like we mentioned, that there are fenestrations within the sinusites. So these fenestrations are diminished, and then defenestrations occur within the sinusites. And then there are also constrictions of the sinusites. After the constrictions, what happens is that the hepatic stellate cells, they get activated, and activation of these stellate cells with the deposition of collagen. As you can see, within the space of disc, which was a unique space between the endothelial cells, what really happens is that collagen starts to form between these spaces, and ultimately fibrosis occurs. So this is what really happens within the cirrhosis of the liver at a very microvasculature level. So this is the reason why because of the fibrosis and because of the ultimate restriction of these blood flowing through these different layers, what happens is that there's an increase in the resistance, there's an increase in the pressure within the liver.